We're glad to have Chief Morris back for part 2 of our healthcare discussion. Chief Morris, thank you for being with us again today.
You're welcome.
Now, are all insurance policies acceptable under the employer mandate?
No, at least not at the moment. Once the 2015 mandate goes in place, all insurance in the country will have to meet the ACA required qualified plan. And those qualified plans contain certain essential benefits. Some of the key items are the insurance coverage must cover 60% or more of the expenses. There's 4 plans available through the state, 60, 70, 80, 90% coverage. The other factor is the premium to the employee cannot exceed 9.5% of household income. Now, how the IRS is going to determine whether a spouse is employed or their 16-year-old kid is employed and how that affects that 9.5% is unknown at the moment. So that's what's required. Now, the state insurance exchanges are subsidized, and that puts the current traditional employee-based employer-provided insurance at risk, because the subsidized state packages are competing with the private insurance, and the private insurance are going to have a great deal of difficulty providing the same level of insurance when the state packages are being subsidized by the government. And so long-term, the employer-provided insurance is going to be a great risk.
Now, what happens to employers who are big enough they have to offer health insurance, but they don't?
Well, that's one of their choices, and it's a $2,000 a year or $166 a month penalty. And even today, with the rising cost of premiums still going higher, taking the penalty and paying it is far less than the current cost of premiums to their employee. So employers, perhaps including the employers of fire departments, may choose to drop that, may choose to push insurance coverage over to the exchanges and be subsidized.
And now I'm sure there are fire chiefs that are a little unsure how this is going to affect them. What do you suggest they do?
Well, they can come to our workshop, but they must get connected with their health benefits administrator, whoever that might be. Check in with their current insurance coverage company, because they can provide details and get as much information as they can from the Affordable Care Act administrators and other experts in the field.
Chief Morris, thank you so much for being with us today.
You're quite welcome.